5 most common questions patients ask me about facial paralysis. Number 1, is my nerve going to come back? Unfortunately, after a certain period of time, it's not going to come back. Certainly after a year and a half, you cannot expect any significant return of nerve function. What about at 3 months? Yes, you can expect some improvement, maybe even full improvement. Even if the nerve is still recovering, a static sling procedure is applicable in many cases. Question number 2, patients ask me, if I just do more therapy, will I learn to repurpose my smile so that when I bite down, I can smile? No. In my experience, there's very little retraining that goes on in our brains, especially after a certain age. And you can have a smile when you bite down if you have that kind of operation that repurpose the muscles of mastication. But a spontaneous smile, which is what we all want, isn't going to happen with retraining. Third most common question, why do people treat me oddly after I had a facial paralysis? That's a very good question, and it's because this little bit of our bodies is what we use to interact with other people, and a lot of our brain is purposed toward evaluating what's going on with somebody else's facial features. The other issue is that we have good evidence that there's feedback from our facial expressions. So if your mother ever told you if you smile, you'll be happy, that's actually true. Making the expression helps you to feel the emotion, and feeling the emotion gives you the expression. So that can be a real social impediment. And one of the reasons that I'm very passionate about treating patients with facial paralysis is because if we can restore a normal appearance, at least to some degree, our patient can get out and socially interact more seamlessly and live a happier, more fruitful life. How big an incision will you make to make a sling, and what kind of recovery will I have? Well, it's a very small incision just up here in the temple, maybe 1 inch in length, hidden in the hair, and the recovery is typically very quick, usually no sutures to remove, and patient can shower after 24 hours. Very little swelling and bruising typically, and if you live out of town, you can go home the next day typically. Number 5, most frequently asked questions. Why is my facial paralysis seem to be worse now than it was 10 or 15 years ago? Here's the reason. If you see someone with a complete facial paralysis in childhood, it's usually not too apparent at rest because the child has very few aging changes. But as we age, the 2 sides of our face age very differently if we have a paralysis on one side. So the aging changes on the intact side of the face accentuate the asymmetry that's occurring on the other side of the face. And that's why many of the operations that I'll do in addition to a sling in patients who are over 40 involve reversing these aging changes, such as a modified facelift, because they improve the overall symmetry.